Let me introduce Lemuel Shattuck, a visionary who published the first comprehensive public health report in the U.S., calling for vital records, local health boards, and preventative systems that still shape modern public health infrastructure today. In the mid-1800s, the United States didn't have a health department. There were no national statistics, no formal sanitation systems, and no coordinated disease tracking. Then came Lemuel Shattuck, a Massachusetts educator and statistician, who saw a gap and moved to fill it. In 1850, Shattuck published the report of the Sanitary Commission of Massachusetts. It was the first major public health document in American history, and it changed everything. He documented poor living conditions, high infant mortality, and widespread disease in urban areas. But more importantly, he didn't just point out problems, he offered solutions. Shattuck proposed state and local boards of health, collection of vital statistics, births, deaths, and causes, school health programs, sanitary inspections, clean water and waste systems, health education and preventive services. Many of his recommendations didn't happen right away, but they formed the blueprint for what would become the modern American public health system. In fact, almost everything he suggested would later be adopted by cities, states, and even the Centers for Disease Control and Prevention, CDC. What made Shattuck's work so powerful was his vision. He understood that health wasn't just about medicine, it was about systems. He showed that governments have a responsibility to protect public health through data, infrastructure, and proactive planning. Today, when we track life expectancy, analyze disease rates, or implement school vaccinations, we're building on the foundation Shattuck laid over 170 years ago. He may not be a household name, but his impact is everywhere. Next in Part 9, we fast forward to the 20th century, where chronic diseases rise, and public health has to adapt.